Let's talk about solidarity. A round of applause for Dr. Vergés, President and CEO at Oafi, and Dr. Torres, from President of Oafi-Semdor, and from the Puerta del Mar Hospital. And we would like to welcome Jordi Bosch from Institutional Relations at the Pharmaceutical Bank. Welcome to three of you. Missing microphone 2 for Dr. Vergés, and he promised that he's gonna swallow it all. Now, isn't that a nice title for a presentation? Solidarity Actions. If you have heard, listened to our radio shows, and if not, we are there waiting for you on Mondays at 8 p.m. and then on Oafi Sports as well. And it's Cultura FM, a radio station, and you in Facebook Live you can also follow us. And we always ask for people to become members. I tell people that we want to improve our training and raising awareness, and for that you can become a member. 60 euros per year, 5 euros a month, and you get discounts to many places, and one of them is the Solidarity Consultation. Dr. Vergés, with free appointments, and a person was telling how he was for 50 minutes with Dr. Vergés. So I guess that this makes you recover any member fee. So every 15 days at Maestranza Clinic, and also in Madrid. This is an action for solidarity, but there's also work done with Semdor on this clinic for solidarity and with the pharmaceutical bank in order to provide better support, better choices, so that the pharmacist feels supported by serious, meaningful organizations. So Oafi will be there supporting in your efforts. Do you have a presentation? No. We'll play it by ear. Well, I do have a presentation. Yeah, I knew there was a presentation, and I was about to ask you what the pharmacy bank was about, so I'm sure that we'll now get to know. Thank you very much to the organizers to let us explain what we do and to tell you about some basic needs such as medication ease. We are a small NGO, and we have noticed that there are people in Spain that have to choose between eating or getting their medication. Some people unable to pay for their medication out of the 2012 law, where some people had to pay for 40% of their medication drugs and couldn't afford that. In Spain, we have child poverty, food poverty, housing poverty, energy poverty, but no one seems to mention medication poverty. Our origins date back to Italy in the year 2000. We landed on Spain in 2007. Little by little, there's been a series of proposals, and then in 2015, the Medication Social Fund was created. In 2018, the Observatory for Medication Poverty was created, and we visited the pharma industry, and we told them that there was no such recognition here on pharma poverty, and so we decided to collect data to see if we could prove that this was real indeed. And we brought together a group of experts on pharmacy, on medicine, on social economy, on experts on IT and statistics, and this was the beginning of this observatory. Well, along with, for instance, Dr. Vaquero has also pulled up his way to make this possible, and I must thank you for you being there from the very first moment. And we made possible this project that was trying to respond to a need. People unable to pay for their chronic treatments, and them being unable to do so made us realize that this was leading to a problem, because if you cannot pay for your chronic treatment, eventually some other conditions will appear, meaning an overcost to the social security system, so the healthcare public system. So we made a pilot test in several Spanish areas, and then the patients have to meet certain requirements. They need to be registered in the Spanish healthcare system with 6 months, possibility for renewal, long-term treatments with a TSI 003, that's contribution of 40%, and cost over 20 euros per month. And now, over 7,000 medication plans that have been paid, 1.2 million euros all in total, 700 chemists that participate, and 220 healthcare institutions where we are present. By looking into this data, and we have published some scientific papers, we have realized that 241 of the recipients belong to the rheumatology patients. Hence, this is what's most related to what we're discussing here today. These are some data on our recipients, where 78% are over the age of 50 and 82% are women. These are rheumatological recipients, by the way. On painkillers, 56% of recipients with rheumatology are on opioids. 55% of our recipients in rheumatology have been prescribed some of the medications in this set, GT2, and 26% of the recipients are within the rheumatology diagnosis groups and were prescribed medication on the group related to bone conditions. We want to keep on working on that area. We have signed an agreement with Oafi, and we have an understanding with Dr. Vergés. We are really happy on his professional approach and his availability. Like on Monday, he is having this free consultation, which is something that we are very much into in our ethos as an NGO. So it's like we kind of fell in love with one another, so we decided to work from the observatory with projects that we will also elaborate with José Luis on processes related to rheumatology patients. That's it. Thank you. Thank you very much, Mr. Bosch. Dr. Vergés, this is important because Oafi is networking with a series of organizations and practitioners in order to bring greater strength. In unity we grow stronger. So this is a hospital association, and the pharmaceutical world. We are closing the loop. How can you bring this relationship? How can you make it possible? Now, who made the call? Well, it was a bit by chance. We were looking. We wanted to be in touch with patients. Often we healthcare practitioners are very much time tight, and on the patients' associations that we were looking into, we saw that Oafi was a highly scientific and friendly society and well organized, and so we got in touch with them. I think that we both like one another. I think we have the same perspective on what to do with a patient, even from different approaches. And from here we started with scientific cooperations, and we wanted to do some further steps now, testing that with the consultation for solidarity. And as Dr. Batet, considering what we can provide as pain experts to Oafi patients. So when Oafi gets the requests, they screen out and they send the most complex patients to me. These are patients from all over Spain. We have a phone call consultation on what they could do and where they could be referred. And then we've had a group of patients that are really satisfied and with a good response, but then we wanted to do some more, and maybe we could have sort of an official relationship so that Oafi members can go to some Semdor doctors with a discount, and so that they can receive personalized care, knowing that here in Spain we all get our public health care, but often people find it hard to shift from their primary care to the specialist, even more so in the case of pain experts, where we have such a long waiting list. So we wanted to find a way in order to overcome this obstacle, and so that the patients that might be, well, if members might receive a discount, and if not, we would try to incorporate the cost and to turn this into a face-to-face consultation Spain-wide. But we need to find a way. But anyway, let me stress this, because when you see some patients coming to a Solidarity clinic, and this is something that we did because it was asked to us by patients and the scientific committee, and so we provided for that to support other people, and even people lacking the means, the financial means. But as Dr. Batet was saying, and mostly that's on the back. The back is quite dramatic. This discal hernia, this pain, and pain in other joints, and we cannot go beyond with the available medication. And I get some patients in my office at an advanced stage, and sometimes even with some suicide attempts, and we need to move fast. And you are like miracle makers to us. And we are all aware. For us, doctors, and knowing that this is a vocational job, you have your conscience, and you know you have to act fast for people that you feel like they're in danger of committing suicide, for instance. And so we ask for volunteers to get in touch with them if they are in need for a therapist, for a psychologist or psychiatrist. So we do our best, and this is what Oafi is about precisely. We are people trying to help one another, and this cooperation is crucial. And in the case of Dr. Batet, whenever I referred some Barcelona patients, they've been delighted. And I know that I've referred some patients to you. Well, it really takes some hard work to make them feel fine. I know that, but we have to do that. Same for you. And I know that you have some tight agendas, so yours is a true blessing, what you give us. And as far as I know, there is no similar thing. So once more, we are being innovative. And this is Artro 360 will be submitted to the different regional parliaments and the Spanish parliament, and we will try and improve on that. And this second step, and we'll see if we can bring this to a close before the end of the year, so that we can move on to this second step. I think that the world we're in, where we have so many people living in solitude with chronic diseases, mobility limiting conditions that make you feel bad because you feel like worthless, you are like unable to do anything at home, we might not be able to provide them with a great treatment, but at least they want to be listened. At least. So staying there for 10 minutes, and they may be going through their life experiences for 10 minutes, and you remain there silent. And that's healing, nevertheless. It's healing for the body and soul. And I think that we need to work along these lines on this dehumanized world where only apparently is youth and beauty what matters. Where many people is not like that, and many people, they have hurting pain in their back, and you know that people will die when they're 90. But that means 40 years of poor health, of poor quality of life. And doctors do not know how to approach these patients because they are really difficult to treat. You cannot provide any remedy for that. So we need to take them into consideration through physical therapy support, through psychological support, so that they can have a better quality of life. And we'll be doing that. And I think that we are very much alike. We are stubborn, and this is something I often tell, that we need to instill this into the residents' minds. Often it's much like House, the TV show. It's like, have you spoken to this patient and touched their knees? Well, young doctors have been trained based on scientific evidence, on the Anglo-Saxon paradigm, and if there is no scientific evidence, they often reject it. But other than that, other than science, often the healing lies in the relationship between doctor-patient. And young doctors have not been trained for that. They have been trained on pharmacology, technology, and if there is no response, you're just ousted. And medicine has never been like that. When you cannot heal, you need to provide some support, you need to provide some listening, and that's healing by itself. Some patients where I have done close to nothing, but just by listening to them, they are doing better at least for 3 months. And this is medicine as an art. And this is something that needs refreshing, because it's not just science, evidence-based, and if it's not published in English, it's just not there. Yes, I agree. I always say that, as far as I know, joints do not bite. So please do look into their knees. I mean, it's not just the ultrasounds that matter, but really, you need to touch them. I'd like to ask Mr. Bosch, if I may, and that's also related to the ISADOA's programs, things that I did not know, such as 7-8 different medical organizations and patient organizations coming together against what the healthcare department wanted to do, which was defunding the ISADOAs. You know that these are slow releasing drugs with very low interaction, which is great for chronic patients since it leads to no comorbidities. And I'm a listener also myself, and Dr. Vergés would say, this costs 20 euros. And I said, what, 20 euros? Is it that much? Well, to some people, 20 euros is really a significant amount. Now that we're talking about crisis, now that you never know how much the shopping cart will be when you go to the supermarket. So, Mr. Bosch, are we facing a situation where people is not on their medication, even though they would need it, in order to be alive the next day, so that they have a quality of life, and yet they cannot have it because of they're lacking 20 euros, 40, whatever. I mean, they cannot make ends meet, and so they cannot buy their medication.
The Medicine Social Fund was created in 2015. And this was the result of a visit made to the pharmaceutical bank by social workers. And they said to us, in Barcelona, there are people who cannot afford to pay for their medication. They are chronic patients. And the question is that we ask ourselves, let's look into it. And when we started with the project and we realized it was real, we saw that this reality responded to an outlook in which people had to choose between eat or medication. They were chronic patients. It was shameful. People didn't say so, but the social workers were starting to get to hear of it, when we've been able to attend 7,000 beneficiaries. When you spoke about the observatory, I forgot to mention something which is key for us. In the short term, the observatory wants to size up this pharmaceutical poverty. In the midterm, we want to visibilize it, as we have done today. We are allowed to see this reality. And in the long term, we want changes in legislation to refund some drugs, because society and the situation of many vulnerable people requires total funding of all drugs. In my case, 4 weeks ago, I was detected with osteoarthritis. I'm 58 years old. It's incipient. But now I wonder, for those people who are alone, who are at home, who cannot buy a drug, who have amazing pain, and who have no resources, what a situation we're living in this society. Society is aging, we're looking after our bodies, but we're hiding this. Why are we not showing it? So we are happy to connect with proposals that go beyond just solving or putting a plaster, but no, focusing on the root of the problem, legislative change. We see this in the pain unit every day. At the pain unit, some people that cannot buy moderately expensive drugs, we got in touch with the labs to send them free samples that they have, and they give them to us so we can give them to the patients because they can't buy them. Similarly, with some patches that can be cut when a patient only needs half, we save the other half for that kind of patient. So pharmaceutical poverty is a reality. But in Spain, people cannot talk about it because it seems that everybody's entitled to public health care. We have it. But access to certain drugs is something that people do not have. People say to us, I know this drug is good for me, but I can't afford it. And we need relationships with them, with the industry, or a different way to be able to benefit from the drug. Let me give the floor to Maria Teresa now. But before that, how does the doctor react when the patient says, I won't be able to pay for this drug? Well, you are touched, negatively touched, because you know that's going to be good for him. And this is something that 5-6 years ago I couldn't see any cases of. But now I do see it more often. And sadly, it doesn't look as if things are going to improve, right? No, on the contrary, all drugs, biosimilar drugs, they're all getting more and more expensive. Now, the Director of Patients of Oafi, Maria Teresa Vergés, tell us. Microphone 2, please. How lucky are we to have people like these? We always listen. We always get the bad news, but they are good people. Everybody here, they probably have relatives and friends in different parts of Spain. Tell them to call Oafi. I will send the information to Dr. Torres. We are visiting patients in everywhere in Spain. In Latin America too, right? Well, we can't get there yet, but you could. But the pain unit is only here in Spain. Tell them to call us. The professor and doctor will talk to you, and if need be, they will be referred to the pain unit. I fully agree with what you said. You can count on us. You know that they know me at the ministry. You know, I've been knocking at their door pretty often. But we need to be more vindictive. But years ago, they were not charging the prices that we are paying for now, and I don't see any demonstration, right? We are getting blows from everywhere. We always need to be politely vindicative. Count on us for everything. We need to be polite protesters. On Monday, actually last Wednesday, we had Sol Ruiz from the Spanish Medicines Agency, an incredible person. And I already said something to her. And the Director General for Pharmacy, I will send a letter to him. I'll call him on Monday. Because there's a problem with lack of supply. For example, this week, Dr. Muller and other rheumatologists told us that there are no corticosteroids in the market. There aren't any. So there's an important group of patients, rheumatic patients, who cannot be treated because there are no intra-articular corticosteroids, which is a treatment we use. Why is this important? I discussed this with Carlos Lenz the other day. He had been with Fernando García Alonso, Director General for Pharmacy as well, with Santiago Niño Becerra. They exchanged their views. Well, why? Because these drugs are so cheap that then the pharmaceutical companies need to have it, but it's not profitable for them, so they do small batches because they are required to have them. But at times like these, you know, with rheumatic diseases in October, there's always a peak. Rheumatic diseases such as OA, there are different times during the year when there are peaks. This year there was not a big peak because the temperature is rather warm. I don't know what temperature we have right now, but yes, the warmest October since 1961. So what are we going to do as the Foundation of Patients from Oafi? And we've got a Director General for Pharmacy that he's a great person, well known. That's César Hernández, a rheumatologist, and we can call him and say, César, this is happening to us, what can we do? And then go to the director of the Spanish Medicines Agency and say, look, we're having this problem, what should we do? Because otherwise we'll see that there will be no intra-articular treatment. Dr. Carnet, for example, who was here with us as a moderator, had to take the intra-articular corticoid for his hip, and in the Menorca hospital, coming from Italy, there were none here. And it's even worse not to be able to pay for it and follow a treatment. But it is important and we are on it. José Luis, we need to start projects in this area, right? Pharmaceutical area. I think that what you have seen and what you will see over on the YouTube channel is the other side of Oafi. Oafi brings together the task force, all the first 4 panels in English, representatives of I don't know how many million people with OA from around the world, under the umbrella of the Arthritis Foundation with 2 million members. Oafi organizes congresses in Barcelona, in Madrid, doing forums, next one in Malaga, providing visitation, with radio program, television program, clinical trials, tests. But this is the other side, the charitable side. I still don't know how you manage it. Sometimes I get up in the morning, and 6 years ago, and we do so for many different things. First, because we have an incredible team at Oafi, because we have many volunteers and patients like the ones you see here, all of you. We also have an extraordinary team of friends, doctors, and from different specialities. And I think we're doing good. As long as we can do good, we will do it. At least we try. Yes, I always say there's a lot of evil out there. A lot of evil. But we are the force of good. But I must say, at the end of the day, we are really exhausted. This was left for me. Who will be the recipient of this award? Dr. Torres. Luis Miguel, congratulations. Let me tell you the story. A year and a half or so ago, we said, what could we do as a gift to those of you who are very special? Many people help us, but some of you help us a lot. And some of you do or go the extra mile. So having you here, Dr. Batet, and an association like yours is a great honor. So we wanted to give you this tree of life. You might see things there and ask yourself, how could they know that? Because in her free time, Maria Teresa is a detective, you see. So this is just as a reminder of us, so that you remind us, and so you carry on doing the great job that you do as a doctor and as a person. Thank you. Mr. Bosch, Mr. Torres, Mr. Dr. Vergés, thank you very much.